going to be your nurse today. Can you tell me your name and your date of birth, please?
My name is Mr. Otis Kitchen, and I was born January 2nd, 1959.
Okay. So what brings you into the clinic today, Mr. Kitchen?
I started having difficulty breathing, and my feet started getting fat, and I'm wondering why my feet is swollen.
Okay, when you're having that difficulty breathing, are you having that when you're active and during your daily life, or are you just having it all the time?
When I'm active doing my daily duties.
Okay. All right, so what I'm going to do is I'm going to go ahead and take a listen to your heart and your lungs, and maybe take a listen to your, feel on your pulses, okay?
Okay, that's fine.
Okay, take a deep breath in for me. Another one. One more. Okay. 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 All right, one around back here. All right, if you could just go ahead and breathe normally for me and take a listen to your heart. Okay, now I'm going to listen to your lungs again. Deep breath. Okay. All right, let me take a feel of those pulses. Okay. Then take one. Let's see. There is some swelling here. You don't happen to smoke, do you? Or have you ever smoked?
Yes, I smoke a pack a day, and I'm trying to kick the habit, and it doesn't not seem to leave me at all.
Okay. I also saw that before I came in your chart that you have a history of heart failure. Are you on any medications right now?
Mr. Kitchen, remember to take your meds.
Don't listen to her. Every time you do, you have to pee like a racehorse.
You may have to pee, but the benefits will outweigh that. Go ahead and take your meds.
No, you don't need to take your meds. You feel better anyway, don't you?
You are feeling better, but you must take your meds as prescribed. Doctor's orders.
Oh, forget about her.
Yes, I have a couple of medications, and I take them a couple of days and feel a little bit better. Besides, it made me go to the bathroom a lot, so I stopped taking them.
How long have you not taken them?
Let's see. Maybe about a month ago.
Okay, Mr. Kitchen, it really is important that you take your medications as prescribed. You know, even if you're starting to feel better, it's your medications that are making you feel better. I understand that sometimes it's a little inconvenient, but it's important that you stay on top of it, okay? As I remember, you were on Lasix. Oh, look, here comes some super meds. Thanks, guys.
Otis, my man, remember me? My name's Lasix. I'm a loop diuretic. My job is to reduce sodium and chloride in the loop of Henle. What does that do, you ask? It reduces your total fluid volume, which is going to make you pee a lot. So this has the potential to reduce your potassium too much. You're going to eat some bananas for days. Also, you probably want to cut down on your salt intake. It's okay, bro. You can just flavor that food with some Mrs. Dash or some sriracha. Most important thing to remember is you're going to have to weigh yourself daily. I know. Nobody wants to see that number on the scale every single day. But we're monitoring your total fluid volume. So you need to weigh yourself in the same clothes, at the same time, and the same scale every day. And remember, if you take me like you're supposed to, I'm going to help all that swelling in your shoes.
Thanks, Lasix. Very informative. Really interesting. Jeez, Lasix is always such a fountain of information. I mean, he always gush about how great he is. My name is Katopriu. I'm angiotensin converting enzymes inhibitor, which means I block the angiotensin converting enzymes that releases renin to use to make angiotensin 2. Angiotensin 2 will cause vasoconstriction, which means your blood pressure will go up. You might just think of me as ACE inhibitor, have been known to be so good at my job that I can give you hypotension. So, be careful when rising up from bed because you might feel dizzy or faint. I can also irritate the lungs, so you should stop taking me if you begin to cough and tell your healthcare provider. Not that was a problem. I mean, you didn't have any problem with that before. Another thing I can help you with is your breathing. I decrease the occurrence of dyspnea or difficulty in breathing. That way you can take a long walk. I also like long walks on the beach and moonlight peaks.
All right. Okay, Mr. Kitchen and nice nurse lady, it's time to pull out the big guns. And that's me. I'm digoxin, and I'm a cardiac glycoside. My job is to increase the strength of contractions of your heart so it'll work better. I slow your heart rate down so that you can push and squeeze your heart better. With great powers comes great responsibility. I reach toxic levels if you're not metabolizing me enough. So, if you see green halos around light fixtures, call your physician immediately. Be sure that nice nurse lady takes your apical pulse for 60 seconds. And if it's lower than 60, just don't. Eat a low sodium and high potassium diet. You should be doing that anyway with my colleague Lasix. Oh yeah, and keep up your blood work. Lasix and I play really well together, sometimes too well. Lasix can boost my potency. Just remember, I am the one that makes your heart work better. And now, back to you, nurse lady.
Okay, I will start taking my medication better now and stick to the rules.